I know you guys were here last year. Was anybody else here last year when I did this? I don't think so. Nope, okay. So the presentation that I have for you today is really kind of a get to know Medicare. How many of you guys are already on Medicare? Who's still working? Okay. So if there's anything that is just you're really confused about or you really want to know about, please interrupt me or ask questions. I got quite a bit, but it's a pretty high level overview, so I want to keep it as pertaining to you as I can. But because some people are not nice, I always have to give the disclaimer. We have all kinds of rules around working with seniors and working with Medicare, so we do not offer every plan available in your area. So if there's any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all your options. I won't be going over anyone's plan specifics today, but just everything related to Medicare, we have to be super careful about. So, this is me. And actually we have our frog is our mascot. We have a big mascot. We do call him Kiwi, so I just give Troy a little bit of trouble for that, but people mispronounce our agency all the time. And then these are just about me. These are my baby. Well, that's actually my baby. This is my son Preston. He's gonna start working with us. He does have a sister, but these are my four-legged babies. So this one is the one that eats my glasses all the time. So they are counter height doggos. So we are crazy that we have now 3 of them. We used to just have the blue boys, and now we added Arlo earlier this year. So I love my dogs. They're my world.
It's all right.
Don't worry.
I'll let it go.
So these are like the top 10 questions when it comes to Medicare. What is it? Who can get it? Do I need it if I plan to work past 65? What does Medicare cover? Where can I get more coverage? What does it cost? How do I pick what plan to have? Because I know you guys get inundated with mail and phone calls and ads on TV. So, and when can I change my coverage and how can I save money? So those are the big questions that we get asked. So what is Medicare? It is a federal health insurance program, and it is funded in part by the tax dollars that you pay while you're working. So your Medicare taxes that you pay. It is an individual policy, so where you're at work and when you're working, you usually have employee spouse coverage. Sometimes it's not like that with Medicare. Each person's plans are individual. People ask about, can I add my wife to my plan? No, you can't. It's individualized for you. It is not free, even though for Part A you pay a $0 premium. It's not free. You've already paid into Medicare with your quarters. And it is not a family health plan, it is not Social Security, and it's not Medicaid. Medicaid, high level overview, Medicaid is based on income. So people kind of mix those words up sometimes. So Medicare and Medicaid. Medicaid is income based only, whereas Medicare is based on it's just that program. Who can get it? U.S. citizens and Louisville residents can get it too. Legal residents. You have to be in the U.S. And for 5 years in a row before you can apply for Medicare. People age 65 or older, those that are younger than 65 with a disability, and at any age if you have end-stage renal failure or ALS, you can get Medicare. Can you have both Medicare and Medicaid? Yes, you can. It's called dual eligibility. So those with really low income, they could have both. Do I need Medicare if I work past the age of 65? You can generally, it depends, always, and we just had a conversation about that. Do you mind if I share?
No, go ahead.
So he has his coverage through his wife. She's paying about $200 a month for him. So the discussion was, do we need to go on Medicare or do we need to do the plan at work? And I will always tell you that it depends. So anyone that's still working, the way that you would evaluate that when you're turning 65 is that if you, sometimes employers require you to, so you would want to check with your HR department to make sure that either you do or they don't care. Or if you do have the option, we really just sit down and do math to figure out whether it's more cost beneficial for you to stay on your company's plan or to take Medicare, because if you're gonna have full benefits to basically replace what you have at work, you will need to enroll in Part B. You will need either a supplement or a Medicare Advantage plan, and potentially a Part D plan to cover your prescriptions. So it really comes down to math, is how we figure that out. And then, So if you end up staying on your company's plan, then you can delay your Part B. You don't need to enroll in that yet, unless your company requires it. We already talked about that. One thing that's pretty important though is if you are taking any part of Medicare, you can, if you have an HSA plan, you can no longer contribute to that. You can still pull money out of it, but you can't put new funds into it once you are enrolled in Medicare. What does it cover? Part A covers the hospital. It covers your facility charges. Part B is the medical insurance. It pays for your doctor portion of your health insurance. It pays for durable medical equipment, diabetic testing supplies. Those are the types of things that original Medicare covers. So it has A and B. None of the letters make sense, ever, other than D. D is the only one that makes sense. Let's see, Part A covers your hospital rooms, prescription drugs, and medical supplies during an inpatient stay. Then lab tests and things like that, skilled nursing services, rehab facilities. Those are the types of things that are covered under your Part A coverages. And then Part B is, fun facts about it. It's premium free if you've worked your quarters, which I have met no one ever that didn't get Part A for free. It happens, but I've not met anyone that does. You cannot be denied for it. It does have national coverage. Original Medicare has national coverage. And you have 60 lifetime reserve days of, Medicare covers a certain amount of days of hospitalization, and then you have 60 lifetime reserve days that you can use throughout your lifetime. Part B covers your doctor visits, annual wellness checkups, your labs, x-rays, MRIs. Some health programs have smoking cessation, obesity counseling. All of your therapies are going to be covered under your Part B, mental health care, ambulance services, or ambulatory service centers, and emergency room services. Those all fall under your original Medicare Part B. Fun facts about it. Monthly premium is adjusted for your income. So there's a chart that they put out every year that says if you fall in this tax bracket, this is what you're gonna pay for your Part B premiums, and they do look back 2 years on that, on your taxes.
Is that our individual?
It depends on how you file your taxes. So if you file jointly, there's a column. If you file individual, there's a column for there. You cannot be denied for it, and coverage again is national coverage. There is a penalty if you enroll into it late. So you wanna be sure that whenever it's time for you to make that decision, the way that you don't get a penalty if you delay it is if you are enrolled in creditable coverage, which generally most employer coverage is considered creditable. So you would avoid the penalty that way.
Is there still an enrollment period for Part B if you are covered under another health plan?
Like under your employer's health insurance, there's not an it's called a special enrollment period at that point. So it's sort of like a qualifying event like you would have on your group health insurance. Once you come off of that plan, you have 60 days to make a selection. We usually try to time that right at when you are gonna leave work, when that coverage ends, so that you don't have a gap. Let's see. Medicare, what it doesn't cover. Original Medicare doesn't cover prescription drugs. That's why you need either a supplement or, a Medicare Advantage plan or a Part D plan to cover your prescriptions. It doesn't cover dental, vision, or hearing care. It doesn't cover eyeglasses, long-term care. It doesn't cover that. It's a good idea to have some long-term care insurance or some sort of life insurance that has that ability. It doesn't cover excess charges for services by doctors that don't accept Medicare assignment, and it doesn't cover care received outside of the United States. Where can I get more coverage? So when people are enrolled, you've decided it's time. I'm gonna go and I'm gonna enroll in my Medicare. You have really two directions that you're gonna go. This side is the Medicare supplement side, or Medigap, those words are interchangeable. Or you do the Medicare Advantage route. And it really boils down to preference of what makes you more comfortable with what you're doing. The Medicare supplement side, you would need I would recommend a Medicare supplement policy and a prescription drug plan. Or if you did the Medicare Advantage plan direction, it works more like your traditional health insurance plans, where you have co-pays and you have a network. They have large national networks, so it's not a huge concern. But it also combines your prescription drug coverage in it, so it would cover everything. And on this side, you would have, on Medicare Advantage side, you would have one ID card. On Medicare Supplement side, you would most likely have 3. Any questions so far? Nope. All right, Part C. And it's another way to get your Medicare benefits. It's an alternative to the original A and B. You're still enrolled in Medicare, but your coverage on a Medicare Advantage plan is no longer administered by Medicare. It's administered by a health insurance carrier. So Medicare pays them a fee every month to take care of your health insurance. Most of them offer prescription drug benefits. Anybody a veteran? Thank you for your service. If you receive, if you can go to VA and get all your services there are special plans that they have for veterans that you could look into. They're pretty interesting. My father-in-law was a veteran, and he ended up going with a Medicare supplement policy, which when he died of cancer, and it really helped him out at the end. But you have choices. Let's see. All Medicare Advantage plans cover all of your Part A, all of your Part B benefits, all of your prescription drugs. They also offer additional things. Some of them have benefits for dental services, some have eye exam benefits, hearing test and hearing aid benefits, as well as fitness program, right, for Silver Sneakers. That's a big program, yeah. So those programs are ones where you can go to any gym. You don't need any participating gym. You don't have to have a membership to those gyms any longer. You could use your Silver Sneakers membership. There are different types of plans within the Medicare Advantage world. There are HMO plans, which are, you guys remember back in the 80s when we had the plans where you had to go to your doctor first and get a referral, and then if you wanted to go anywhere other than your doctor's office, those are more of the HMO plans. They tend to be less expensive, and the networks tend to be skinnier. And then you have PPO plans, which are the more of what we have in this area. And then we have special needs plans, dual plans, which are for those that are Medicare and Medicaid eligible. And they also have chronic needs plans that are for people that are, that have very specific chronic illnesses. And then you have private fee-for-service plans and medical savings accounts. We don't see a lot of these in our area, but the main 2 we see are the HMO and the PPO in this general area. Fun facts. For Medicare Advantage plans, you can't be denied for coverage. On the Medicare supplement side, you could, in theory, be denied. You may have to use a certain network, which sometimes makes people a little bit nervous that they don't want to do that. And you would need potentially a pharmacy network as well. The coverage cost can vary by year to year, but in reality, so can your Medicare supplement policies, because as you age, the price of that is going to go up. And they do have annual out-of-pocket costs that are covered, that are associated. Yes, sir.
Is Medicare Advantage linked to your income, total income?
No.
Okay.
The only thing that's linked to your income are your Part B premiums. Potentially, I believe there's an add-on cost for Part D if you're in a certain income bracket, and if you're Medicaid eligible. That's the only time it's related to income.
So this may not be the time for this question, but if you're deciding on whether you're using an Advantage plan or picking each one that you want, what's the benefit of an Advantage plan over picking what you want if you don't want dental or vision or hearing?
You don't care about any of that stuff?
Yeah, I mean,
Yeah.
and can you, at some point, go into an Advantage plan if you elect to do the A, B, and D?
GD, whatever.
Yeah.
Yes. The answer to your questions are yes.
Okay.
So if you don't care about the extras that come with it, a lot of people will go the Medicare supplement route just because it's, your out-of-pocket costs are known. So if you have a Medicare supplement policy, then whatever the Part B deductible is for that year, that's pretty much what you're gonna pay in any given calendar year for your medical care. You would have a separate prescription plan, which that doesn't count, but the Medicare Advantage plan, they have premiums that are $0 premiums, so your monthly cost would be lower, but you would have co-pays when you go to the doctor. A lot of times, they do have $0 copay. They've come out with some really nice Medicare Advantage plans. But if you don't care about that, you just really just want the freedom and the known cost, then people will go the supplement route.
Okay. And the Advantage plans, everything goes through the insurance company, whereas the other side, you've got different
Yeah,
things you have to be accounting.
sort of. So if you have a Medicare supplement policy, what you do is you go in with your red, white, and blue card, you get the Medicare supplement card, you give that to your doctor, they file with them first. Then when Medicare's done and they've paid their part, then they will send it to the insurance carrier that is your supplement company. And then they will send you an estimation of benefits form that shows what they've paid and what Medicare paid, what they paid, and you make sure that all your services are covered that way. And as far as can you switch back and forth, so if you enroll, and we'll go over this a little bit more later, so we might be able to skip a slide then, but if you enroll in a Medicare supplement policy, and when you turn 65 or when you're first eligible, like when you leave work, those are guarantee issue at that time, no medical questions are asked. And then you decide later that you wanna join a Medicare Advantage plan, then the only time you can do that is during the annual enrollment period, which is starting next week.
Okay.
And it ends, so it starts October 15th and ends December, no, 7th or 15th, I always forget which it is. And then it ends December 7th. Which almost sounded weird that it ended on Pearl Harbor Day, but anywho.
Can you go the opposite way?
I know.
I can go Medicare Advantage back to supplement.
Yes, you can, and in the first year, first 12 months, if you try a Medicare Advantage plan, if you don't love it, you can go back to your other plan, to your Medicare supplement plan, and they have to accept you, but it has to be with the same carrier and the same plan,
Within the first year.
within the first 12 months of that policy.
Okay.
Yes,
No, like today, I'm supplement.
okay,
I can go to Medicare Advantage.
and if we do annual enrollment period, yes, you can do that
Medicare
then,
Advantage.
January 1st, your
Next year,
coverage.
can I go back to supplement?
Yes, within the first 12 months, no medical questions, after that, you would be subject to medical questions. Does that make sense?
Could go up.
The premium would go up because you'd be older, but yes, but you have guaranteed acceptance back into your Medicare supplement policy the first 12 months that you're in a Medicare Advantage
After
plan.
that, then they might say.
Yeah.
No.
They might say no. Yeah, they're rude that way.
Yeah, that's all I know.
Yeah.
Is that 12 months after the first year or 12 months? The year?
If you were in a supplement and you jumped to a Medicare Advantage plan, it'd be basically 365 days from the date your Medicare Advantage plan was effective. So if it was effective January 1st, you would pretty much have until December 31st to go back to your supplement with no medical questions. Okay. Some people love them, some people hate them. It just all depends on what is your personal preference. I had a guy go, well, just tell me what you would do. I said, I can't do that. I wish I could, but I can't. And I don't have a crystal ball to be able to tell you what your next 12 months is gonna look like, as much as I would love to. So prescription, Part D prescription drug coverage is a standalone prescription plan. So if you have your Medicare supplement policy, it does not cover outpatient prescriptions. You would need a Part D plan. Most people, you can evaluate those each year, because sometimes drugs move formularies, as far as where they fall on the tier. One year it might be a tier 2, next year it's a tier 4. So it's a good idea, especially if you're taking anything that's pretty expensive and you have a Part D plan, that you look at that for each of the annual enrollment periods to make sure that there's no big changes that will shock you. On the Advantage plans, your prescription drug coverage is included on most of them.
Is there, if you do an Advantage plan, if you change later, is there a penalty for not having the prescription drug plan before?
If you were in an Advantage plan and you moved to a Medicare supplement policy, there's only a certain time of year where you would wanna do that, because there's only an open enrollment period where you can get that Part D plan. It's like the Medicare, it's on here, we'll get to that. But, if you go without prescription drug coverage while you're eligible anytime, then there is a penalty that you would pay for the rest of your life for the number of months that you did not have a Part D plan.
So if you have an Advantage plan, is the penalty if you switch, or since the Advantage plan has prescription, you wouldn't have a penalty?
You would not have a penalty as long as the time that you enrolled in the Medicare supplement policy was during a time where you could get a Part D plan. If it wasn't, then you would potentially be looking at 1, having no prescription drug coverage, and 2, having a penalty. It's 1% of the national average of cost. So I would say the average Medicare Part D plan probably costs around less than $20. So 1% of that for each month that you don't have coverage. I have one client refuses to get a Part D plan. If you ever need it, I mean, it's not a lot, but it's still not fun to look at that on your statements each year, on your social security
So that's how they
statement.
figure the penalty then, because there were some questions, they didn't know what the penalty was, and they couldn't find the answer to that question.
Who couldn't?
Well, there's, some people I've talked to.
Oh, yeah.
Yeah,
The Part D penalty is 1% of the national average for each month. The Part B premium or penalty is different.
okay. Maybe
It's
it's that
in
one they couldn't figure out.
Yeah, it's in here. It's, so, hold that thought, we'll get there. So when I say formulary, this is what I mean, the tiers that your prescription drugs fall on. Everybody remember that? One drug costs $5, one drug costs 10, some are 30, some are 40. It's all decided on by how much they are. That's where the carriers put them. Anyone who's a diabetic, a lot of the carriers are coming out with or enrolled, they participate in the insulin savings program, where for a certain list of insulins, you won't pay more than $35 for them. Not all of them do that, some of them do, and it is a specific list of those insulin products. Let's see, the ever famous donut hole. This is kind of how it works. You have your annual deductible, which is going up to $505 for 2023, and not all plans make you pay that. There are a couple of standalone Part D plans that don't have that deductible, and many of the Medicare Advantage plans don't have any, you pay that Part D deductible. And it's, most of the time it only applies to like tiers 2 through 4, or tiers 3 through 4. So your $5 drugs are not gonna make you pay the first $505 up. And then during your initial coverage phase, which was where you're paying the normal co-pays that are in your benefit summary, the total cost of that, which is what you pay and what the insurance carrier pays, those added together are what is included in the initial coverage phase. And then if you hit the coverage gap where Medicare's not paying for it, it's only your cost up to it's moving up to $7,400 is what it's gonna be, up from $7,050 in 2022. So it's gone up quite a bit. And then if you get past that number, then you're gonna be in the catastrophic phase and you won't be paying. It's like 2 or 3% of the cost of the drug. Most people don't ever hit that. Some do, some don't.
What is the coverage gap again?
So during the coverage gap is when Medicare's not paying any part of it. It's all on you. You'll pay for your drug entirely.
Why can they not
Because
pay?
whoever designed this was really cruel. That's just how it is. They just don't pay it during the coverage gap. They won't pay for your prescriptions at all, but everything will accumulate towards that $7,400 that you would pay. And then after you've reached that number, then you'd be in the catastrophic phase, and you pay very minimal for it. I know they're supposed to be working to decrease that number as we go through the years.
So you could be having a certain drug and then you can quit paying for it, is that what you're saying? After a certain amount?
After a certain amount, and then after you've spent so much, they will start paying again. And they give us these really nice tools, and they have it on Medicare.gov too, where you can put your prescriptions in, and it'll tell you each month what your expected cost will be, and also by the plan that you choose. It's a really nice tool. It's not exact, but it's a really nice tool to help you try to figure out how much you're gonna be paying each month. Let's see. To have Part D, you do not have to be enrolled in A and B. You only have to be enrolled in A or A and B. You don't have to have both. I don't know why you would, but you don't have to. Generally there's a pharmacy network. Most of the carriers don't, like Walgreens. UnitedHealthcare does. They're the only ones that do. Let's see, your coverage can vary based on which plan you choose, and you want to change that each year. Generally, I will review it with any client that wants to review it. If you are taking lisinopril and that's it, you probably don't need to review it every year. Other than a couple of years back, Humana did something kind of tricky. They got rid of 2 of their plans and only kept their most expensive one, and they took people that were paying like $12 a month and mapped them to a plan that was like $85 a month. So those people, if they didn't take any action, were mapped to the most expensive plan. There was nothing we could do about it. So we try to let you all know if that's coming. Hey, we know this plan's doing this. You might wanna review it this year. But in general, if your plan's gonna renew and it's working for you and you're not really taking anything very expensive, you're probably pretty safe to just move forward, but always happy to review with you. Some people just don't want to. Let's see. Medigap, Medicare Supplement Insurance. It is, if you think about your red, white, and blue card, your Medicare Advantage plan just kind of sits behind it. Medicare pays first, then Medicare Supplement policy pays next. And it will just pick up pretty much what the Medicare Advantage plan, or excuse me, what your original Medicare does not pay for, other than the deductible. Let's see, they are available in every state as long as your doctor accepts Medicare, a doctor and hospital accept Medicare assignment, they will take your Medicare Supplement policy. They will accept those benefits. You won't get balance billing for the most part unless you're in certain plans. And they do have select, they're called the select plans, which means that there is a select network of hospitals that you would need to use, and they tend to be a little less expensive than the regular ones. But if you're traveling and you go to a doctor, or excuse me, to a facility that is not in that select network, you would have to pay the Part A deductible. So if you're someone that travels, I would not go with the select plan personally. Let's see. It's really important to remember that those plans do not cover your prescription drugs. You won't have any coverage for that. You won't have any coverage for dental, vision, or hearing. There are separate things that we can get for you. If you want to go on a Medicare supplement policy, we can get you an individual dental and vision policy. No coverage for vision or long-term care. It does have coverage for hospice care. It pays pretty much most of the time. Most plans cover all of the expenses that you would have for healthcare other than that Part B deductible. Here's a chart. Can y'all see all that? So really what you want to look for is what does it cover, right? From the columns down. So the plan that we tend to do the most is the Plan G, because it covers everything other than the Part B deductible. Some of them like, where is it? So some of them cover part of the, where did it go? Where are the excess charges? It's the G is the only one that covers the excess charges. So that's where if you end up at a doctor's office that doesn't accept Medicare assignment, then they can charge you up to, I wanna say it's 3 times what Medicare assignment would be as extra. Think of it as like out of network coverage. That's the one time you would see an excess charge. But between the A, B, D, all the way to M, and remember, this has a Plan C, but plans are different than parts, right? So these are insurance plans, not part of Medicare. They are the same from every insurance carrier. So if you have a Humana G, it is the same as a United Healthcare G, as a Aetna G, a Cigna G, a Medco G. They're all the same. The coverage is exactly the same. The difference is that what are you paying? What is the stability of that carrier? Those are the differences between them. Any questions? All right. You do have to have A and B in order to get a Medicare supplement policy. Because remember, it's gonna sit on top of your Medicare, that Medicare supplement policy is, and pay the difference. So you have to have A and B in order to get one. There's no medical underwriting if you are enrolling it on, it says 6 months, but think of it as 3 months of either side of your 65th birthday if you're aging into Medicare. And it's guaranteed renewable. They will continue to have the plan for you as long as you continue to pay your premiums. And they do vary from carrier to carrier. And would you believe that plans with more coverage tend to cost more? Crazy that, right? Let's see. How much does Medicare cost? So you have your premium that you pay, deductibles if you're in and really in the Medicare Advantage or in the Medicare Supplement world, co-pays if you go to the doctor. Do we have co-pays if we're on a Medicare Supplement policy? Nope, no co-pays. And then you have co-insurance, which is, like, for example, insurance carrier pays 80%, you pay 20%, which you don't see on the Medicare supplement side, only in the Medicare Advantage world.
Is there a difference in cost for different regions?
Yes. Would you believe Florida is super expensive? I've had a client that was like, I'm moving to Florida, I'm gonna get this policy, and I was like, well, let me just pull the rates for you. And I was like, are you sure you wanna move? Cause it's expensive. So on the Medicare supplement side, if you get your coverage while you're in Kentucky, you can just change your mailing address when you move to Florida. But for your prescription drug coverage, you would have to change to a Florida policy if you did that. So here's that chart of the Part B premiums. If you are filing as an individual and you make $97,000 a year or less on your modified adjusted gross income, the premiums are actually going down for 2023 to $164.90.
Here's what I found.
Oh, she's so helpful. It's going down to $164.90. And then if you are a household joint, if you file jointly, it's $194 for the first bracket, and then it goes up from there. And that slide is very small in your packet. But these are just the numbers for 2023. Any questions? And this would be based on your 2021 taxes.
This is a question, just curiosity more than anything. You know, the premiums are going down this year because of drug. He's saying because of drug costs are going down. They went up last year because drug costs went up, but
Which is funny.
it's
to me.
only for
It doesn't
hospital
compare.
stays, right?
Yeah, yeah.
It's only for hospital stays.
I know.
It has nothing to do with outpatient.
No, that prescription drug, I mean, if you have a
Something's
D,
going
you
down,
pay for
something's
it.
going up.
Yeah, Part B deductible's going down too for 2023, which is good news. Something went up though, what was it? I don't remember, I'll have to look. It's not, it was like something that I didn't think applied to a lot of people that was going up. All right, so on the Medicare, things you pay. Part C, you could have a premium as low as $0, but you would be subject most likely to a deductible, copay, and co-insurance. If you have just the Part D plan, you would have a monthly premium, potentially a deductible, always copays. Sometimes co-insurance on like your tier 5 or 6 medications, the really expensive ones. And then Medicare supplements, you would always pay your monthly premium. Annually, you would pay the deductible, and then you would have copays. No, that's not true for most people, because we don't have those on the Medicare supplement policies. How do I pick? The ever-burning question. It's comfort level. At the end of the day, that's what insurance is. It's what helps you sleep at night. If you want to have the extra stuff that comes along with the Medicare Advantage plan, like the dental, the hearing, they have rides if you need to go to a doctor's office. They have, what are some of the other fun things they have? Some of them will help pay for utility bills. You can pick between those things of what you want to have. They'll send you meals after you've left an inpatient stay in the hospital, so they have a lot of extra perks to them. But they do have networks for a Medicare Advantage plan. Whereas your Medicare supplement policies really don't, for the most part. If you were in a traditional Medicare supplement policy, you'd be hard pressed to find a provider that's not gonna take it. That's why they don't give us network books, because pretty much everybody takes it. Then step 1 is if you're gonna do it, you need to enroll in A and B. If you are still working, you would want to delay your B, and most likely, and only, you can take your A, it doesn't cost you anything, or you can delay it, you can do either one. And then you would either enroll in your Part D and your Medicare supplement policy, or pick a Medicare Advantage plan. There's really just 2 directions that you would go. Just kind of like we talked about on the Medigap policies / Medicare supplement policies, they tend to have nationwide coverage. The monthly plan premium is there. It will, again, it'll go up as you age. And what we're seeing a lot of people do also is as those premiums, because they're gonna get higher, right? Like when you're 85 years old, it's gonna be more than if you were 65 years old. So as the premiums start getting higher, some people will start shifting over to the Medicare Advantage plans that were originally in the in the supplement policies.
As long as they can qualify health-wise,
Well, if you wanna move to Medicare Advantage plans, they don't ask medical questions.
at any point.
No, you just have to enroll during a certain time period, during the annual enrollment period.
If you go back, then you have to have.
If you do it outside of the 12 months,
Outside of the 12 months.
you'd have to pass underwriting. Yep.
All right.
When can I enroll? If you're aging in, as we call it, turning 65, it's 3 months before your 65th birthday or 3 months after your 65th birthday. Your coverage always starts on the 1st of the month. So if you were born on October 12th, your Medicare coverage would have started October 1st. So it's always gonna backdate for you. Enroll early if you can, if you know what you're gonna do. Faster you get it done, the sooner you get ID cards and you can get all of this done and kind of rest your head and not have to worry about it. The general enrollment period, this is where we were talking about the switching. So January, for those who missed their initial enrollment period, you can enroll in parts A or B in January, and your coverage starts in July. So you would have a gap there if you waited. Then you can choose to enroll in a Medicare Advantage or prescription direct plan in Part C and D during April, May, and June. Coverage starts in July. There are late penalties that apply if you do that though. So remember, your birthday's coming. Make sure you get it taken care of. Yes, ma'am.
So if you turn 65 and you're still working, you still have to enroll in
No.
May?
No, because you do not have to. This is for people that did not have creditable coverage outside of their Medicare policy. So for people that are on individual health insurance policies, either through Connect or through, maybe you have an old health insurance policy that you just kept forever before Obamacare came into force, when you turn 65, that plan terminates. They don't accept people that are over the age of 65. So in that situation, if somebody didn't take care of it, they would be looking at potentially having a penalty. Medicare supplement open enrollment period is when you turn 65, and then you have 3 months. Really, they say 6, but because it's 3 months either side. If you want to enroll within that first 6 months or that 6-month window. Special enrollment periods are if you lose employer health insurance, you have 60 days to get enrolled. If it is a move, you have, you have 8 months for all, within you enroll in Part A or B, the last month of employment of health insurance. I don't think that's right. I think it's 60 days. You will have the first 2 months to enroll in Medicare Advantage. 60 days to enroll in that, 63 days to get a standalone. It's 63 days for a prescription drug plan, but 60 days for a Medicare Advantage plan. And then, you have 8 months to enroll in A or B. Get it done sooner. Just, if you don't wanna have a gap in coverage. If you know that you're getting ready to retire, get with somebody that you trust to help you get your enrollments taken care of. The late enrollment periods, here we go. Part A, the penalty is 10% of the Part A premium. Part B is 10% of the monthly Part B premium amount for each full 12 months that you were delayed. So if you miss 12 months, you're paying 10%. Then this is Part D. The penalty is the average Part D premium for each month you delayed enrollment. So if you delayed your enrollment for 12 months, you're basically paying 12% for the rest of your life of the average cost of that Part D plan.
Is that all of those or just on Part D?
For each month, so Part B is for the 12 month, you have to be out a full 12 months. Then Part A, the penalty is for, there's no premium for it, so they put it up there for those rare birds that don't get it. But if you've worked your quarters or you have a spouse that worked their quarters, then you have it at 0 premium. When can I change my coverage? If you're of a Medicare Advantage plan, it's during open enrollment. Pretty much outside of that, you're a little bit stuck unless you have a special enrollment period. Medicare supplement policies, if you have one of those and you find one that is less expensive than the one that you're currently on and you qualify to be able to move carriers, that you can do at any time. But the Medicare Advantage plans and the Medicare Part D plans for prescriptions, you can really only make changes during that window, with coverage changes being effective the first of the following year. And then the Medicare Advantage open enrollment period is when you can, it's available to those that are on Medicare Advantage plans only. You can switch to a different Medicare Advantage plan or enroll in a standalone Part D plan, go back to original Medicare and get a supplement. I think it gets super confusing with all these windows. Qualifying life events would be like moving, leaving your employer coverage. That's when you have that window of that 60 days where you can make changes. How can I save money? Make sure you get your preventative services done, please. Make sure you get those done, because if you're having them send your doctors on top of your care and they're not finding something that's gonna be more expensive later that they could have treated earlier. So it's really important to do that. If you are in any sort of network where your policy has a network, if you have a prescription drug plan, it's got a network. If you're in a Medicare Advantage plan, it's got a network. Try to stay inside your network. Be aware of what those are. Ask about generic or low tier prescription drugs. If you're taking medication, ask if there's another one available. Another good resource for prescription drugs is GoodRx. Has heard of it? It's fabulous. Fabulous program. There are many times that on GoodRx, your prescription costs are gonna be less expensive than if you were to use your insurance. So I always, especially if you're gonna take something that costs a decent amount of money, I always check that first and see what that's gonna be versus what the pharmacy is gonna charge me through my prescription. If you do need help, there's extra help paying for Part D, there's Medicaid, there's Medicare savings programs that'll help you pay for your, it says Part A, but everybody's getting no charge. For your Part B costs, you do that through the state for the most part where you would start. If you or anyone you know might need help paying for those premiums or drugs. Where can I go for help to get help? No, seriously. You can go to anyone that find an agent that you trust to help you. I'm happy to help you, but if you have somebody that you already work with, please just reach out to them and have them help you. Make sure that you get, all the correct plans, talk about the different directions that you can go and make those decisions. But I'm happy to help anyone that wants help. There are resources available to you. Medicare.gov is a wonderful resource. It's a pretty user-friendly website, and they are super helpful. If you call them, their number is 1-800-MEDICARE. During the annual enrollment period, October to December, their lines are a little busier, but they are generally answer the phone pretty quick. They're stateside, so you're not talking to someone you don't understand, and they're just really, really helpful. So that website is a huge resource. And then if you need extra assistance to pay for anything, you can always contact the local Social Security office or the Medicaid office to see about getting help there. For anyone that's coming off of employer coverage outside of when they're turning 65, they will require extra documentation for you to be able to get enrolled with no penalty. I usually suggest that when that's gonna happen, make an appointment with Social Security and go there and get it all taken care of while you're there, because they'll tell you exactly what you need to bring. And that's it. Any questions?
Does a provider get the same fee for non-supplement versus advantage?
No.
I figure if you're going into PPO, so they're getting paid less, and most likely if they're PPO.
Well, because they're gonna get the Medicare reimbursement rate on a supplement. They're gonna get the Medicare reimbursement rate, and then they're gonna get the difference of what.
They can charge. You signed up for their,
Yeah, so it really depends on which plan you're in. If you're in an HMO, it'll probably get paid, I would say a little bit less, because most of them, the networks for the HMOs are smaller, so less providers take them. And if you are enrolled in an HMO, make sure you verify whether you need a referral to do anything. Some of the HMOs you need referrals, some of them you don't. So make sure you know whether you need a referral or not. On the Medicare Advantage plans, there are so many of them that are $0 premiums now, that if you were to take an HMO over a PPO plan that typically has a national network, generally the reason why you would do that would be for all those extras, the extra dental, the extra vision, because the benefits for those types of things tend to be a little higher on those HMOs. But can't tell you what I would do personally, but personally, I would not take an HMO, just cause I want the freedom to go to a larger network. And then that Medicare supplement policy probably gives you the most freedom as far as doctors and
So
things.
there's no HMO, PPO supplement?
No, well, sort of, I mean, if you wanna talk about the select policies, they're not really an HMO, but they would be, I would call more of the equivalent because of that select network of hospitals.
Some physicians can opt out of Medicare.
They don't have to accept the assignment,
Oh, they have to set this up.
yeah,
If they're not in network, then they just don't take them at all. You can't be a Medicare patient in those offices.
you can be, but you'll pay for it,
Okay.
yeah.
I just didn't
Yeah,
want to-
and your concierge doctors, I know a lot of people, I have a concierge doctor, a lot of people have them now. You're still gonna pay your concierge fee, they will file with Medicare for like your labs and things, but you're not gonna see co-pays or anything like that. And if you take an HMO, they're not gonna be in an HMO network, so you wouldn't be going, for sure wouldn't be going in that direction at that point.
But you're saying PPO network, most doctors are supposed to take PPO.
Most, yeah, most.
But you hear the horror stories about, the anesthesiologist that doesn't.
Yes, yes, yes.
You know?
Now, you have, in that scenario, you have, they call them hidden providers. So when you don't really have a choice, a lot of times if you will kind of complain to the carrier a little bit, they will reimburse those and pay those as in network, most of the time. But, and, the other thing that people get kind of confused about is they're like, oh, well, if I go to see a doctor for an emergency or if it's an emergency and I go to another facility, and that doctor or whatever is not a network, I'm still covered. Yes, you're covered, but you're covered under the out-of-network benefits, and they will pay that doctor what they would have paid a doctor that was in network, and then that doctor's gonna send you a bill for the difference. So it is covered, but it's not covered as well. My friend found that out when he was in a bicycle accident in Texas,
Do
and
the
got a bill for
insurance
10 grand.
companies, do the insurance companies pay Medicare to get you, or does Medicare pay the insurance company to take you?
To get you or me?
If
The insurance.
Humana had to say, we want to take Medicare patients, Anthem had to say, who's paying who?
So,
They're taking them away from the Medicare. You're
Medicare
buying-
pays the insurance company.
You're
don't they?
you're taking me away from the government.
Mhm.
Anthem's buying me, or Humana's buying me for the year. So who's
Anthem or
paying who?
Humana or whoever is being paid by Medicare to facilitate your services. So the carriers make a nice bit of money off of the Medicare Advantage plans.
I've heard that the biggest profit is because the federal's now put quite a lot of preventive in it, which is.
There's a lot to be said
like
about
walking
value-based.
and all these
Yeah.
preventive things, but 90% of people don't use it, so
They
that's how
don't
they
use
collect
it,
the
yeah.
money, right?
People don't go in for their well checks.
Huh?
Yeah, so there's a lot of, value-based services that are out there now. There's facilities that are, some of them only take Medicare Advantage plans, some of them will take Medicare Advantage and Medicare supplement policies. Most of them will only take seniors. And they are really great organizations. You have a doctor, a traditional doctor through call it Norton's, whatever, that they probably have 2,000 patients on their panel that they care for. With a lot of the value-based centers, they have maybe 200 to 500 patients on their personal panel. So you're getting a lot more of that one-on-one attention. They have a lot of, many of them have different disciplines within that practice. So you might see the speech therapist or physical therapist, or some of them have a pharmacy, maybe right next door, or even a facility. So there's a lot of those that are coming around that I think they're great, just because you have such personalized care with your physician. But those are coming around, so they're great. They like you to come take a tour of the facility and all that good stuff. But other than that, that's okay. Yes, sir.
So I see these commercials with Jimmy Walker,
Joe Namath, yeah.
Joe Namath,
Mhm.
and it's the same, you put your zip code in and you could get money.
Mhm.
I mean, what's that all about?
Some of the carriers have what's called a give back. They have a Medicare Part B give back. It's very common on the plans for those that are veterans. Most of the carriers have a give back for that. I wanna say Aetna is the only one that has a give back on their traditional PPO. So they will give you a certain couple, like $50, $60 every month back towards your Part B premiums. So they're out there. you know, depending on why you're buying that Medicare Advantage plan, it may not be worth it to go that direction because of the benefits that you will lose elsewhere, if that's why you're getting it. If you're, you know, it might be a lower dental benefit, or it might be a lower vision benefit, or the amount of money that they give you in, they have over-the-counter prescription, or over-the-counter cards where they give you X amount of dollars each quarter to use. A lot of them have, it's called a flex card. They will give you money back, $500 a quarter or whatever, or a year, not a quarter, to pay towards your medical, dental, or whatever expenses if you wanna use that. So there's lots of perks within those policies, but the biggest difference is the freedom within those, in my opinion, is that one has, I can go anywhere pretty much, the other one has a network that if it's, you know, if Norton's decides that they're gonna pull out of the network in the middle of the year, cause it happened in what year was Obamacare started? 2014 was when that started. Norton's wasn't in network with Anthem for almost the whole year. That meant that all those kids that were getting emergency care, they were getting some bills if they were on an Anthem policy through the exchanges. So those doctors can come in and out of those. But for the most part, our big hospital systems, they're in all of them, especially locally.
So something in there, I just wanna understand this, it says if you're not working, when you turn 65, you're automatically enrolled in Medicare, but you still have to pick your plans, or?
If you're not working, when you're automatically enrolled in, most likely if you're automatically enrolled ever, it would be automatically in A. You
Okay.
generally have to decide on B. You have to let them know what you're gonna do.